Thank you so much for your interest in GlycoAla Bio Microneedling, and I wanted to share this video with you of me doing the treatment on many candidates, just so I can run through some treatment protocol with you. So I would usually start the procedure really with a cleanse. Now, if a client comes into me with makeup on, I'll do maybe pre-cleanse oil, clay mask, and then go into a cleansing wash. I would usually use either the Sebi wash from Environ Skincare, purifying cleanser from Lumiere, cleansing gel from Environ. With the biomicroneedling treatment, I always look to make the whole process as comfortable and as pleasant for my client. So I'll have her legs comfortably elevated, the bed nice and warm, and I'll spend a lot of time. I'll bring the cleanse right down onto her chest as well. These are really nice fan brushes we picked up on Amazon, and I use them quite a lot in the glyco treatment. So I'm going to do a really nice cleanse, make sure there's no trace of makeup on her skin. This is Kira, one of my colleagues, who when she started working with us, the first thing I did was GlycoAla Bio Microneedling. I'm very passionate about all team members experiencing how this treatment feels. I don't think anyone should be doing this treatment unless they've had the treatment done, because you really need to have good communication skills with a treatment like this. It's very hard to explain to someone how it feels to have spicules in your skin. So definitely you want to feel it so you can then communicate that to the clients. So I'm just using some warm mitts here to remove the cleanser, making sure that Kira's skin is squeaky clean. And the most important part of all treatment, and GlycoAla Bio Microneedling included, is that you take really good photographs of the skin beforehand. I would usually do that if the client presents to me with no makeup. I'll do it before I even cleanse, but if there's makeup on, obviously I will cleanse as well. And that's really important, because how are you ever meant to show the clients the results? Both she and without doubt he or she and without doubt you are going to forget very soon how their skin was prior to having GlycoAla Bio Microneedling done. So you really need to log those photographs. I always like to do the cleanse, and then I like to replace my tissues so that I'm really nice, because guys, you never know which shot is going to be the money shot. So I'd usually put really nice fresh tissues down, and then I'd line up my light and take really good photographs. Try to get all pigmentation, scarring, etc. into the shot so that you can evaluate the changes next time you meet your client on what has occurred from today's treatment. So you see me there looking at my watch. That was me getting my timer ready. I'll always time how long I'm massaging the product in for, and in my treatment notes I will note down the amount of pumps I used and also the amount of time I spent massaging the spicules into the skin. So with Kira here, I'm using 3 pumps, usually for everyone's first time. To be honest with you, most of my clients is 3 pumps. I find it's plenty of product to use. Might go up to 3, 4. I rarely go beyond that. And also I would advise that you put a little X on the bottle of biomodulation gel every time you do a treatment, so you can manage your stock controls as well, see how much you're using, etc. So here I am gently massaging the product into the skin, probably going a little bit fast here. Again, you want to slow the movement down, make the whole thing as pleasant as possible for the client. So I'm working the spicules into her skin. I would usually start off with these massage movements, and then I'll do these massage movements early, and then how the skin responds to those movements will tell me a lot about how the treatment is going to go onwards. If she starts to come up very red initially, and it depends obviously on her skin type and how familiar you are with her, I might then swiftly go into gently pressing the product in and using less movements, which is obviously very much boosts the microcirculation and can add to the overall erythema. So this is all, I'm almost doing a skin analysis with this as well, by seeing how she responds. And if she's absolutely fine with it, I'll keep going with this movement. If there's no response to the skin, I may increase my pressure a little bit. And if she's coming up very red very quickly, I will release the pressure I'm using and use less, and then go into very strategic massage movements. But again, constantly looking at the skin, seeing how the skin responds. I will include the neck, but not as intensely as I will the face. So if you imagine, maybe I'll do 70% face, 30% neck. And then I'll also bring it onto the chest as well if there's pigmentation or photo damage there too. I will gently press it into the chest area also. So now you can see I'm going into that kind of pressing movement. And I find that very good, particularly when you're targeting any lines or wrinkles like around the eye area, on the upper lip area as well. And here I am working on another client of mine, Mimi, and as you can see, her skin is Fitzpatrick 5/6, and this is another reason why I love GlycoAla, because it's a very safe treatment for Fitzpatrick 5/6, where we would want to stay away from any kind of thermal energy or any energy that could trigger pigmentation. With Mimi, she came to me with serogomas, which I would really struggle to treat on Fitzpatrick 5/6 without the risk of pigmentation. So I did also mention to her that the overall texture of her skin was contributing to the serogomas, and if we improved her texture, got her skin healthier, they may be less apparent, and that turned out to be the case. She absolutely loves the GlycoAla treatment. It completely got rid of all kind of congestion and texture around her eyebrows and forehead, and her makeup sits far more beautifully since having this treatment done, and her skin just responded so well to the treatment. So like that, it's great to have that offering for our Fitzpatrick 5/6 clients who we obviously would not want to use lasers on, etc. You can see here I'm doing very gentle movements as well to her skin, working it all around and just bringing it down onto the neck area. I'm doing my circular movements initially, then evaluating how the skin responds to that stimulant, and then working off that information that the skin is giving me all the time. That's what I love about the GlycoAla Bio Microneedling. You as the practitioner are completely in control at all time, something that you can't always say for microneedling, particularly any thermal energy lasers, etc. as well. You get to decide how and where you want to administer the most amount of stimulant in the area. Her skin, like I said, responds beautifully to this treatment. She's a big fan. Now, the whole point of me creating this video is I want you to have that visual, so you know exactly the kind of movements that are done with GlycoAla, and just for references as well. This is my client Aisling. She travelled to me in London for her first treatment. She flew over to Dublin to have her second treatment done, and then she will see me again in London for her third. Now, her concern was around the eye, fine lines, etc. The skin was a little lax in that area, so this, you can see where I'm holding the skin taut, and I am just pressing gently but firmly, pressing the spicules into this area. And also this is showing the client that I'm concentrating on her area of concern as well, and really targeting that area. Aisling was blown away. I've actually used her content a lot of her messages to me, etc. She's absolutely blown away with the treatment. She absolutely loves it. And she got really great changes and a gorgeous result. I'm going to show you actually at the end of this some of her videos that she kindly sent to me of the day of the treatment, the day after the treatment. This is my client Lottie. Lottie is she works for RTE, and again, she's one of the first clients that I've ever done a GlycoAla Bio Microneedling on. She would have been a huge microneedling fan with the needle at a depth of 1 millimeter, collagen induction therapy CST, which is a lot more invasive, would have involved a topical anesthetic. And then I would numb her and then just do lots of cuts in the skin, and then it would have taken about 2 hours. She would have been quite red afterwards, a lot of downtime, etc. As you can imagine, her skin always responded beautifully to microneedling, and GlycoAla Bio Microneedling is no different. She would request this treatment for me. She's a huge fan and has sent me so many clients. She gets a really beautiful result from this treatment. And as you can see, just like previously, I'm starting the treatment by gently massaging it in and watching for how that skin responds. Now, because I've done this treatment many times for Lottie, I can be a little bit more invasive with the treatment. I know how her responses are going to be. I'm including the neck area as well. I'm working around the mouth there. Just gentle, firm pressure. Again, I'm timing it probably 5 to 8 minutes. As if I want to intensify the treatment, I might even do it for as long as 10 minutes, and I might use maybe 4 to 5 pumps as opposed to 3. I'm doing it on the neck area, but very gently. Just remember, the neck has less hair follicles. It's kind of more skin like the lips as opposed to the face. So yes, by all accounts, you want to include the neck, but I wouldn't be doing it very intensely on the neck. And then clients tend to wear clothing up around the neck, particularly in the winter months, like scarves and jumpers as well, which can really irritate the skin if it's already delicate post-procedure. So just to be mindful of that as well. And this is now where I've finished the spicule treatment on Aisling. You can see your skin is nicely pink, and we're about to apply the Revive. And we're coming towards the end of this video, so I just want to say, if you have any questions, go ahead and reach out to me. You'll find me on my socials, or you can email the clinic partners@monicatolan.com. This is me having the treatment, and Carla's applying my Revive gel straight from the fridge with these fan brushes. I'd never experienced this before. Carla did it, and going forward after this, having this done, I always use these fan brushes to apply my Revive because it was absolutely immense. It felt so beautiful and so gentle. I'm going to use Revive as frequently as I wish for the next 72 hours, as is my client, if you wish, whoever's having the treatment done. And then when all sensitivity is gone, return to normal skincare, but still incorporating the Revive underneath their normal moisturizer morning and evening. Carla also used a fan which hit the cold gel and felt even better. It was such a beautiful end to a treatment. Like, it's insane to think I had microneedling done. I was so relaxed. So this is the end of the video now. I've got some stills I want to share with you of clients when they've had the treatment, the kind of peel to expect afterwards, how red they can be. Everybody's very unique to this treatment though, so just to make sure your client is very well informed before the treatment and after the treatment, and well supported, and let them know that redness is normal, some puffiness is normal. A peel can occur, but don't expect it or be disappointed if it doesn't occur. Everybody responds differently, and of course that the results are cumulative. Best to do these treatments in a block of 3 to 4 sessions, 2 weeks apart. Yeah, I think that is everything. So when the images come up, I'm going to show you there's images of before the treatment, an hour or two after the treatment, and a couple of days afterwards, as well as there's Carla using the fan on me now, which quite frankly felt so good, so good. And then also some of my clients peel, some of my clients don't peel. This is Aisling now in the first slide, and that is immediately after, and then the next morning you can see how much the redness has left her skin. A couple of days later her skin felt glorious. This is Quiva, a client of mine who got a peel, loved showing it to me, and Jessica, a good client of mine, before, after day 4 and day 8. And then Aisling had a more intensive version of the treatment 2 weeks later, and she got a peel. Thanks for watching, guys.